My name is Sensei Carl Prather. I'm a karate instructor for Okinawa Shorin Karate. I have a local school in the area. Been teaching now for 31 years, and it is my passion. Several years ago, I started having a lot of knee pain, and I tried everything to get rid of it. Steroid injections, everything, went through the whole process, continued to get worse. So I consulted my family practitioner. She said I was a strong candidate for total knee replacement.
I first met Carl as a patient. He came to me with severe bone-on-bone osteoarthritis of his knees, and he was having trouble performing his normal activities as well as doing the things that he really enjoys, like martial arts.
I started searching for a reputable doctor. I did my homework. I chose Dr. Chaudhary to do it because of his track record and the fact that several years before, my wife had total knee replacement, and he replaced one of her knees, and she's doing really well.
Carl had both his knees replaced in the same year, about 4 or 5 months apart. And after he recovered from one and understood what it was like to be cured of the arthritis and how that was going to go, we went ahead and did the second knee replacement. He had severe deformity, and at times I recommend getting both knees corrected in the same calendar year in order to have a more complete and beneficial recovery.
The pain was unbearable. I will not lie about it before. And recovery, also horrible, but life on this side of surgery, the quality of life is so much better than it was before. I was almost a cripple, as Dr. Chaudhary knows that.
The modern knee replacement is pretty amazing. A lot of people think that they have to give up certain activities or give up things once after they have knee replacement, but the way that we're doing knee replacements now, people can get back to all kinds of activities. And Carl is unique in that he enjoys martial arts, and we were able to do the knee replacements for him and get him back to doing what he loves, which is especially kicking. We haven't had a lot of martial artists have knee replacements, so it was exciting and challenging to do knee replacements for him, and really gratifying to see him get back to really what he loves.
Since my surgery has been done, I have taken up hiking, which I never dreamed I would do before, and I love it. I hike not in neighborhoods, flat surfaces. I hike in places like Houston Woods, Mount Airy Forest. Mount Airy Forest has steep hills, deep valleys, washed out trails. And I go when it's hot, I go when it's cold, I go when it's rainy, and I go when it's muddy because I love it. And I could not do that before.
And knee replacements now are designed for very high demand, so it's exciting to watch people see what they're going to do with the modern knee replacement. And Carl is an excellent example of getting back to it, going after it.
My life on this side, I can't speak for anyone else, is so much better. I have zero, and I'm serious, zero pain in my knees. So if you're thinking about it, please do it.